Okay, first, let's get it out of the way. There has been signs that infusing children with vitamin D has been shown to kind of buffer the beta cells from the immune system from attacking itself, and thus stopping some forms of whatever is causing type 1 diabetes. But that's quite an essential to think maybe back then my vitamin D was low. Could it have caused type 1 diabetes? No. Having low vitamin D does not in itself cause. It's a good buffer, but it doesn't, if you have lots or low vitamin D, it doesn't cause the diabetes. It just sort of helps people from not getting the diabetes. Now, vitamin D also works with the immune system. And we know that building your strong immune system helps you in many different diseases. It also can help with type 1 diabetes. Now, does that mean you go to the pharmacy? This channel is provided for informational purposes only. Contact your physician for any diagnostic or treatment plan. And just load up on it. Again, like most things with diabetes, talk to your doctor. Find out if you are deficient. They did a test on me years ago, and vitamin D was deficient. And for years, I was on vitamin D. And then in 2020, when I went into the hospital, they took me off it, and it's never looked back. So Dr. Shu ordered a test and a vitamin D, and it came back low again. So I can't remember, I think it was a drop, but it had something like 10,000 units, and it was once a week, as opposed to taking the vitamin D every single day. But again, find out from your doctor. There's quite a lot here about vitamin D and beta cell function. So it may help your beta cells produce more insulin, is what I'm reading into this. Vitamin D and autoimmune diseases. Vitamin D and genetic predisposition to T1D. So maybe my vitamin D level was low, and that's why I got diabetes. So is it worth checking all kids for vitamin D levels? Well, it would be a blood test and false negatives and Okay, vitamin D and the risk of T1D. A birth cohort study of 10366 Northern Finnish infants who received supplements since 1 year of age revealed introspective of one dose regarding baseline a reduced risk of developing. So I would have liked to, you can't really go back and take a look. Yeah, I'll go back 47 years and see what no. In fact, coming up soon, this is October 1st, in 7 days will be my anniversary. The excitement is overwhelming, I can tell. Now, vitamin D helps with blood glucose. Through this article, and the one I'm looking at is the openrheumatologyjournal.com. What a name. That's snappy, huh? So, we also know that diabetes also has problems with bone strength. Hence, that's one of the reasons I came down with Charcot's foot, where I can go out walking and break my foot. And this is because of nerve damage, and it causes bones in my foot to possibly break when I come down on it, if I come down on the wrong pressure. For me, it's only affected, if this is my foot, it only affects up here. Yes, look at my dry skin. So it's a little small bones. So vitamin D helps with bones. I was also told that people who tend to be more than a bit overweight had a problem with it. But I've since taken a look at this. Studies have shown that vitamin D can be lower in people with T1D. So it sort of works either way. Vitamin D is a fat-soluble vitamin. You get it from going outside and sunlight. Your body develops. And it's something like you just need to be out there for like 15 minutes. And that's direct sunlight. So climates like in Finland, here in Vancouver, where, sure, the day I want it to be raining out there, it's beautiful, this clear, sunny day. Whoopee. So it adds to bone strength. I've got to talk to the doctor here next time I go see Dr. Shu about getting an appointment and dealing and finding out about vitamin D. So there's an awful lot in here of stuff I don't even understand. But it's worth it you take a look. I'm going to read the conclusion here. Vitamin D may play a role in either T1D pathogenesis and insulin sensitivity, although conflicting data on the effects of vitamin D on the blood glucose control have been reported in literature. Vitamin D supplementation should be considered a promising tool for the prevention of T1D. So the jury's kind of out about vitamin D and the prevention. Most of us, if you're watching this, you probably have type 1 diabetes already, so it's not going to do that much. It helps with sensitivity and thus getting better blood sugar results. My blood is anemic and a hypocritic. Oh, sorry. Hemocratic. He might have just made up a new thing. It's low. So it's always important. Never rely on just assuming. Get yourself checked. It's a simple blood test. See what your levels are. Supplement. You don't need another prescription. You can get drops prescription, but you can also get vitamin D tablets. I always went for the chewable. Yeah, I know. But that helped me in getting my vitamin D up. So I wonder if that's what's contributing to my liability? No. My brittleness. So read up about it. It's important that you learn about T1D. I'm not a doctor. I did my best. I read off a report online, but you too can read it. You can also suggest to your doctor, hey, can we check your vitamin D? If he or she thinks it's important, they will. Nice short little video today. Have a great day and happy October. Bye there. My email is mikesdiabetesworld@gmail.com. mikesdiabetesworld@gmail.com.